Hi, everyone. Welcome to the course. I'm really excited to get things up and rolling with you, especially as we start diving into sort of what we're all here to learn about counseling theories and what those really look like. So, today that's going to be exactly where we're going to start things off. We're going to think about what does a theory really do, and why is it useful when it comes to working in the mental health field or in the helping profession. So, we're going to think about theories and what they sort of bring to the table that we can be really, really useful when it comes to working with future clients. But where I want to start is maybe a little bit in the past. So hopefully this looks pretty familiar to you. Some of these concepts about foundational counseling skills or basic counseling skills. So reflecting, attending, summarizing, using questions. Hopefully these ideas are pretty familiar to you that you've probably learned in previous courses. So all of these skills are extremely helpful. They help us connect to the client. They help us show the client that I'm really engaged with them. I'm listening to what they're bringing to the table. So the skills really help us create that connection and create that bond with a client to sort of make us more aware of what they're bringing into the counseling session, and to help a client see a little more clearly some of the things that they might be struggling with. But one of the things about skills is that, well, they're all terrific and they can all be used for various different purposes. But when should I use them? When should I use reflecting? When should I summarize with a client? When does a question make a lot of sense versus maybe choosing another skill to bring into the counseling room? So the skills can be really helpful, but how and when and why to use them, that's still kind of up in the air. And that's where theory comes into play, because theory is going to help us take some of these skills and funnel them down into a very helpful mode of using them. So instead of using sort of just basic counseling skills willy-nilly whenever I sort of want to, I'm going to put a big X through that. We're not going to just use these counseling skills whenever I sort of feel like using them. We're going to use them in a very cohesive, focused way. And that's what a theory is going to provide us. So we're going to take some of those skills and, according to the theory we're using, use them in a very specific, targeted purpose that is really going to help us connect with our client and help our client make the most progress possible in therapy. So, really, when it comes to using theory, I sort of think of it as a funnel. There are some very sort of foundational things that we need to keep in mind as we're using a theory with our clients. So, the first one that I like to think about is there are three main categories a lot of times where clients might show up and they want to sort of discuss something that might be weighing on them. They might really want to focus on their thoughts, what I'm thinking, the things I'm telling myself, the things I'm thinking about other people or things around me. So some clients really gravitate towards thoughts, and some theories want you to really hone in on what the client is thinking in a specific instance. So some theories are going to want you to focus on that, others maybe not. Feelings can be really important for a client too, feeling discouraged, ashamed, joyful about a situation. So, whatever sort of the emotion is that a client is bringing into a situation can be very important. And some theories will want you to focus on that in particular. And then the last one is behavior. So, outside of what I'm thinking or what I'm feeling, some theories really want you to hone in on what is the client doing in a specific situation. Is a client avoiding some situations? Is a client saying one thing but wanting to do something different? Is there a disparity there? So sometimes looking at the behavior of what a client's doing can be very helpful. And some theories will want you to use your counseling skills to really highlight what a client is doing in their life, because that's what a theory is going to really focus on primarily. Then the time frame can be another one as well. So you might have the classic case of thinking about maybe Sigmund Freud back in the day, where someone lies down on a couch and Freud really wants to think about, tell me about your mother, tell me about your childhood. And so that's kind of the stereotypical sort of thought of what many people think of when they think of doing counseling or therapy. And thinking in a client's past, some therapies really want you to do that. We're going to focus on one of them in this class called Adlerian counseling, that really wants you to focus in on those early childhood experiences and how important they can be to a person's development. Some theories want you to look into a client's past. Other theories want you to get nowhere near a client's past. They want you to focus on a client's present. What's happening with you now? What are you thinking now? What are you doing right in this moment? And anything that might have happened to you in the past, well, it's in the past. There's nothing we can do about it. We're sticking right here, right now, and that's where the therapy is going to really focus on. So again, time frame can be something that dictates where you're going to spend your therapy time with a client. Sometimes in the past, sometimes present, and some are going to push into the future. The relationship is going to be really important as well. Not just the relationship between you and the client. Some theories are going to say that the relationship between you and the client is paramount. It is so incredibly important. Other theories are going to say, I guess it's all right. But you know what? That's not the important thing at all. So if you don't have a very good dynamic between you and your client, it's really not that big of a deal. So again, that's one of those things that's going to shift from theory to theory. But also the relationship between the client and maybe things around them. The client's relationship to people in their neighborhood, their relationship to people in their workplace, maybe just the relationship between them and the person that they're in an intimate relationship with is the only relationship you really want to focus on. So again, relationships from counselor to client and then client to other people are ones that theory is really going to help us hone in on and want us to focus on specifically. And then those skills, what we talked about before. So some theories are really going to want you to use specific skills in order to achieve the goals that are important for whatever therapy you might be using. So some theories are really going to want you to use a lot of reflecting, a lot of summarizing. They're really going to want to use those skills that create a good back and forth and show that client that I hear you and I understand you, but I'm not really pushing you to do anything sort of differently. Person-centered therapy. The first theory we're going to look at is one of the classic cases of really understanding the client, but I'm not going to sort of use hardly any questions to try to push the client in any sort of direction. Now, other theories, rational emotive behavior therapy, or REBT, another one we're going to look at in this course, is all about pushing the client to do things. So REBT is really going to lean heavy on asking questions of the client to really get the client to start to think about what are you doing and are your actions actually helping you achieve goals that are important to you? And if they're not helping you achieve goals, why are you doing them? So it's going to be a little bit more, some might say abrasive, but certainly using questions as a foundational skill rather than reflections, which you might see in other theories. So those things that I just sort of listed on this funnel are good ones to keep in mind. And that all of those sort of go into helping a theory sort of focus where you're going to go with a client in a counseling session. So just good things to keep in mind. Now, this week we're going to do a little bit of a different kind of activity. You're going to be taking a therapy style quiz. Don't worry, it's not a graded thing. It's really just an introduction into the world of different theories and what sort of theories might do in a particular counseling session. So what I would like you to do for this assignment is I want you to answer the questions in the assignment as though you would be the client. So what sort of therapy would you really want to engage with? What would feel good to you if you were sitting down and talking to a counselor? So answer the questions as though you are the client and it's your particular type of therapy. And then when it comes time to write your reflection paper, I want you to do a little bit of research into what your particular therapy style is. You're going to get a little bit of information at the end of the quiz when you get your style presented to you, but do a little bit more research. Look around, see what different websites, different books might say about the particular type of therapy that was presented to you. I'd love to get a little bit more of an insight into what this type of therapy is and what you've learned about it after taking the quiz. And then when you start answering the questions too for the assignment, I want your impressions about what this type of therapy would feel like. Do you think it would be helpful? Do you think it wouldn't be helpful? Again, for you, if you were the client, I want you to make this very much about your impressions of the therapy. So if you think it wouldn't be a good fit for you, tell me. That's great. Just make sure to give me a little information as to why you don't think it would be a very good fit. Or if you think it would be a great fit for you, you think it's something that would really connect with the type of person you are. Excellent. Glad to hear it. Give me a little bit of background around that, about why you think it would be such a good fit. So really, I want to hear your impressions from that assignment. So thank you very much again for taking just a little bit of time to view this video and to get a little bit of background around around what theories sort of bring to the table. And hopefully when you have the chance to take the therapy quiz, it'll be somewhat insightful to see what kind of therapy might actually fit for you if you were a client. So thanks again, everybody. As always, if you have any questions, shoot me an email. Happy to answer anything that might still be unclear. But again, welcome to Understanding Theories, and I'm interested to see what kind of therapies you all come up with after taking the quiz. Take care, everyone.